Welcome to Adapting class. Are you ready for the undergo? Do you want to learn some NCLEX? Let's start with the basics one, right? A 25-year-old male in the emergency room. Right. He's having some knee pain. The nurse trying to figure out, want to know if this patient has sickle cell disease or has hemophilia. He doesn't know whether A or B, but it doesn't matter, right? How about put it hemophilia A? So how would you know the difference? They both have knee pain. So as usual, I give you a table and then you figure it out based on the symptoms I'm going to give you. Like I told you, these are concepts for each individual disease process. So sickle cell. The next one is hemophilia. Which one goes to sickle cell? Which one goes to hemophilia? Which one you need to use soft toothbrush? Which one is autosomal recessive disease? Which one you need to avoid NSAIDs? Which one you have to use a precipitate factor 8? And which one you have to use hydroxyurea? Or which one hematuriosis is big deal? Or which one you don't use no immunization? Tell me, put your answers there. Think about it. What do you think? I see somebody say hemophilia is X-linked. Okay. And somebody say hydroxyurea is sickle cell. Somebody say hemo needs soft toothbrush. Okay, I'm just selecting what you guys say. What you say, I pick. Somebody say 1, 2, 4, 5, 7 is hemophilia. So 1, 2, what? 4. You say 4 is here. 5 and 7. Whoever that is golden, Joseph, Dominic, that's excellent. But you're not done yet. Factor 8 is hemophilia. Okay, I got it. No immunization in hemophilia. I got it. So you just finished it. You guys aced the thing. You see, you ready. You don't need adapting class, right? You guys ready. I mean, you mastered this, the whole group. You aced the thing, Excellent. This is the way it's supposed to be. You left with one more. Autosomal recessive is a sickle cell. So I give you that one. That is what's the shape is supposed to be. Sickle cell, autosomal recessive, you use hydroxyurea. Hemophilia, they are X-linked, they bleed, so soft toothbrush. You have to avoid NSAID. You give them factor 8. They have knee joint problem that usually they bleed into the joint, and avoid IM medication. Classic content. In 2 minutes, you see, you know what hemophilia is in 2 minutes. You know what sickle cell is, right? On the go learning. So excellent one there, everybody. You guys did good. Happy for you guys, right? That's the right answer. Okay. What about if I give you 25 weeks pregnant, G1, P0 in the emergency room? Okay. The next one, you know if the patient has severe preeclampsia, eclampsia, versus HELLP syndrome. So you have to know some of the things associated with that problem. So somebody say AST is HELLP, okay? Somebody used to also say severe eclampsia, urine protein. So I put urine protein. It's a headache. It's some seizure for eclampsia. Seizure for eclampsia, headache, and urine protein. So seizure for eclampsia, headache, and a urine protein. Where is urine protein? Yeah. And somebody said pre-eclampsia, eclampsia. Okay, eclampsia is 4 and 5. Okay, I put it there. 4 and 5. 3.5 for severe. 3.5 is for severe. Okay. Platelet is for HELP. Somebody said platelet is for HELP. Okay, I'm choosing your answers. So let's see how much you know about this. There's an easy way you can figure out this answer choice. So select that or that apply. So somebody say AST, platelet, petechia, right upper quadrant, and creatinine is what? Is HELP. Seizure, yeah. So the definition is precise, right? First you get pre-eclampsia, a blood pressure over 140. But as soon as you get to 160, yeah, everything is severe. Your protein is more than that, right? They still has hepatic dysfunction. They have hepatic dysfunction, right upper quadrant pain. They will still may have right upper quadrant pain. So the AST can go up. They can still get right upper quadrant pain. It's not unique. See, so remember severe preeclampsia, they can have right upper quadrant pain, LFTs can go up, but it's not unique, right? That is the key. Then when they start doing that, when they become eclampsia, you have pre-eclampsia plus seizure. So everything you have for pre-eclampsia, you should still have it in what? Eclampsia, in addition to what? Seizure. Therefore, that should have right upper quadrant, right? Your creatinine, you should still have right upper quadrant, and your what the AST should go up, right? In severe pre-eclampsia, your creatinine is still elevated, so eclampsia, you should still have it there. You see? And HELP means you have bad and severe pre-eclampsia in addition to hematological problem, hematology. So that's why the platelets and the petechia. So all the signs and symptoms we see, their protein is still going to be high. Do you see that? The protein will be high. So if you think about it, you see, that is the thing you have to do. So those are the things if you have HELP syndrome, you already have headache. They have headache. Okay, they already have headache because they have severe preeclampsia in addition to other problems. So don't forget that. Like when they give you this, you have to know all these things happening. The only difference between HELP and severe preeclampsia is the platelet and the petechia, hematological problem. But the LFTs will be there. Okay. So just pay attention to that. So AST, all of them will be elevated. The platelet is the HELP one. Seizure is just eclampsia. Urine protein, all of them. Yeah, urine protein is going to be high because HELP syndrome means severe preeclampsia plus hematological problem. Headache, I have severe preeclampsia. So when you have eclampsia, you still have headache, right? Creatinine, all of them. Creatinine is going to go up. And we all have right upper quadrant pain, except petechia, which is associated with the HELP syndrome. So don't forget that. Question that was asked. So you have a newborn, okay? Newborn, it's a newborn. The nurse teaching mother about car seats. Which of this you should question, or the charge nurse should intervene? Okay, the charge nurse has to intervene or question that teaching. So this is the infant, it's an infant. Is that teaching appropriate? Keep the kid at 45, rear facing until 1 year old. Retainer clip should be at the axillary level, shoulder harness at the shoulder level, and no use of safety belt. What do you guys think? No use of safety belt. So that's what you have to figure out. This is question today. You want to question or don't question? Someone is a question number 3. So question number. Question number 3. So that's what somebody said. We should question number 3. Which one else you want to question? Somebody said 45 degrees, no question. So don't question. No question, red facing. So red facing, no question. 4, 5, 6. Somebody said question number 6. Somebody said number 4, no question. 1, 2, 3, 4. No, don't question. Now there's one more. 1, 2, 3, 4, 5. You said don't question. You guys are absolutely right. I'll give you a select or apply question in the SATA form. You ace it. You see? Select or apply. You see this? This is the way the car seat for a newborn should be. Rear facing and at the back seat. Okay, rear facing until they are what? Rear facing until they are 2 years old. 2 years old. The clip can be at the axillary level or below. The shoulder harness can do the same thing. And you need to use safety belt, whether they are in the car seat or not. You need to use safety belt. It's very, very important. Okay, you need to use that. That is the key for that question. How about if you have a car and no back seat, and you play the car seat in the passenger seat, what should you do for safety? There is no back seat, okay? And you place the baby in the front passenger seat because the car is a sports car. There's no back seat. So you place it there. What should you do? What is the most important thing, your priority function for that situation? Deactivate the airbag. That is your priority. Otherwise, the kid is going to get into trouble. Since there is no back seat and the kid is in front, you need to deactivate the back seat, the airbag. I'll give you a lecture on car seat for the newborn right away, right? Which drugs? Maybe clopidogrel. Desmopressin. Mm, oxytocin. And tennicep. I need I need you guys to tell me something about it. Pick one and say something about it. Something you know about. And I'll be looking. And I'll give you the question. I will make up some question. You guys have 1 minute. Put whatever come into your mind. What come into your mind when you see clopidogrel, desmopressin, pitocin, and etanercept? 4 questions. What first thing come to your mind? So we put antiplatelets here. Somebody said NSAID. There's no NSAID here. You don't have an NSAID here. I only have antiplatelet. What else? How is that? Crohn's. Crohn's disease. DI. Diabetes insipidus. Induction. Making words up. Tachy. Slowly. Hyponatremia. Fluid retention. I see antihypertensive. I don't see antihypertensive there. Somebody say antidiuretic, right? Okay, I'll give it to you. Like, what else do you see? Nasal delivery, headaches, electric razor, right? Neutropenic precaution. This is what we call endogoal lining. I'm trying to see if you guys remember, you see these medication, what do you see? Right? Antiplatelet. We already know this is clopidogrel, right? Crohn's disease, where does she go? DI, diabetes insipidus, where should he go? Induction, where should he go? Tachycystole, where should he go? Hyponatremia, where should he go? Fluid retention, where should he go? Antidiuretic like, where should he go? I'll give you some of the answers. Induction, of course. Pitocin here. I see that. Desmopressin, DI, because he's giving you ADH. Clopidogrel is not a blood thinner, is a antiplatelet. Etanercept, neutropenic precaution. Okay. Electric razor, clopidogrel. You guys doing great. Crohn's disease and etanercept. Think about it. Tachycystole, yeah, that's induction when you're going too fast. How about fluid retention? There's a concept there. Go into the water, So you're going to have fluid retention here. It's ADH-like, so it's going here. But remember, Pitocin is a form of ADH. It acts like ADH. That if somebody Pitocin, you need to put Foley in because they're going to pee. All the water they have retained during induction, they're going to pee everything. So Pitocin can cause fluid retention. Okay, so Pitocin can also go there, fluid retention. So this will also go here like that, fluid retention. And the same thing as desmopressin. Therefore, Pitocin is also ADH-like, right? You got to trace them up. But let's do the hyponatremia. Its concept, look at it, hyponatremia. If you're retaining fluid, your sodium is going to go down. Therefore, Pitocin and desmopressin can cause fluid retention, and therefore they will cause hyponatremia. Now, seizures is because of hyponatremia, and therefore, if you have hyponatremia, it can cause seizures. If you retain fluid, you can cause seizures. You see how it can happen. Anti-diuretic hormones will cause the same thing. Is our concept. This is all related. Headache will come back and bite you here. If you have seizures, it will come back and bite you. The only thing that is delivered nasally is desmopressin. So desmopressin will go all the way here and come like that. So I know it looked busy, but I've given you side effects of that medication. So clopidogrel, if you take clopidogrel and you circle it, it's an antiplatelet. Okay, antiplatelet is going to bleed, so electric razor, right? If you take desmopressin, it can be used for ADH. It causes water retention, so you get hyponatremia. You have fluid retention. It's anti-diuretic hormone. This is going to lead to what? Seizures if you have too much fluid and headache. And it's also going to cause nasal. It's delivered nasally, right? You can also have sub-Q, you can have IV, right? Now, let's take Pitocin. Pitocin is used for induction. It can cause tachysystole. It has ADH-like symptoms, so all this will happen to that. You will go to Pitocin. If that is going to happen, this Pitocin, this Pitocin. You see? And then the last one, before I get out of here, etanercept is used for Crohn's disease, right? And because of that, neutropenic precaution. For medication, side effect, on-the-go learning. Thank you for watching and have a good day. All the best of luck.